Cardiovascular emergencies. We go over some anatomy for the cardiovascular system. So the heart is basically 4 chambers. We have two upper chambers, which are low pressure system. These are called the atria. Right and left atria explained here in R and LA. And then we have the more higher pressure systems, which are the ventricles. These lower chambers, right ventricle, left ventricle. These then contract and then excrete the blood out from the heart. This myocardium, or the heart muscle, then is given oxygen and blood is supplied to it via a coronary artery. Coronary artery. There are 2 coronary arteries. They branch off the base of the aorta. This is called the right and left coronary artery. So this supplies the heart muscle all the oxygen and nutrients that it needs. It also drains from the heart and empties back in through the venous system and empties into the great cardiac vein and into the coronary sinus back in the atria. So all blood returns back into the right atrium. Blood from the body also returns from the inferior vena cava and the superior vena cava, empties back into the right atrium. So here we have blood returning back into the right atria, and as we follow, it goes through the tricuspid valve. This valve is held closed unless blood from the atria are being pushed down into the right ventricle. Then from the right ventricle, blood is then ejected out through the pulmonic valve. From the pulmonic valve, it goes through the pulmonary artery, and from the pulmonary artery, it goes out to the pulmonary system or the lungs. It goes out through these arteries, gets oxygen down in the alveoli, and then it gets pushed back in through the bloodstream back and enters into the left atria. The left atria. So these pulmonary veins bring back blood into the left atria. Left atria pushes the blood from the atria down into the left ventricle via the mitral valve. And then when the left ventricle squeezes, it forces the blood out through the aortic valve and out to the aorta and to the rest of the body so that it can pick up oxygen and have the internal cellular respiration. Internal. We need both systems, respiratory and cardiovascular system, to be working in order for this to function. Here we have the acute myocardial infarction. Is one of the medical emergencies, and I put down pericarditis, 2 of the many medical emergencies that we have in our EMT textbook. The acute myocardial infarction is a part of a spectrum called acute coronary syndrome. This is on the far end of the acute coronary syndrome. On the beginning, it would be something like angina. Angina is pain that comes on with exertion, but usually goes away with rest. Pain plus or minus may be given oxygen or nitroglycerin, but it goes away. In the case where it's not even changing with oxygen, rest, or nitroglycerin, the person develops what's called, I wrote down here, abbreviated as STEMI, non-STEMI, and silent. These are 3 different types of acute myocardial infarction, or AMI or MI, myocardial infarctions that can occur. The myocardial infarction again occurs as a result of the 2 blood vessels branching from the base of the aorta supplies the oxygen and blood supply to the heart muscle, the myocardium. When the right and coronary arteries, if there are an occlusion in any part of that system, the heart starts to die because it doesn't receive oxygen. As a result of that, they may end up having what's called a STEMI and non-STEMI, or silent, but it's still myocardial infarction, cellular and tissue death that's occurring to the heart muscle. A STEMI. A STEMI just means that there is an ST elevation, and when we go over EKG, we're going to find out that it's going to look like this. There's an elevation in what's called the ST segment. But it looks like a normal one would just kind of look like this. You see a P wave, a QRS, and then a T wave, but in this case, the S and T wave are elevated. STEMI. The non-STEMI, there is no ST elevation, there's no tombstone type of appearance. And then a silent MI is somebody that might be a female, or more importantly, the classical is a diabetic patient. Diabetic patients may have no chest pain at all as a result of their MI. They may just be feeling weak, short of breath, really air hunger, and fatigued. So that's a silent MI, in which case they're not experiencing chest pain. Signs and symptoms of somebody having a myocardial infarction would be chest pain, which they clutch their fist over their chest. Levine sign. It's saying that they're having chest pain. It feels like it's a squeezing pressure-like pain. It also radiates up to the jaw and down the left arm. It may actually radiate to the back, and in some cases it may just up to the throat. And remember, the silent one, they're not having any of this type of discomfort. Other symptoms may be shortness of breath, nausea or vomiting. And then their signs, they may be pale, cool, and diaphoretic. They look pale, cool, and diaphoretic. So how do we treat our patient? For our basic guys, we're going to do some good vital signs. We need to get accurate and good vital signs because our treatment for medication-wise are dictated by how well the blood pressure is, how good the heart rate is. And we definitely, besides the vital signs, you're going to want to put on an EKG, a 4-lead, and then later we need to do a 12-lead in order to find out this ST elevation. So we'll be putting on a 12-lead. Now after we get our good vital signs, some of the medications that we give for people that's having a heart attack, we'll tell our patients, if you have nitroglycerin, to go ahead and take nitroglycerin, because this will help with this, alleviate some of these symptoms. But we also want to make sure that they also take a type of blood thinning medication, or aspirin. 162 milligrams, 325 milligrams. We want to get some aspirin on them. And don't forget, what we can give at the basic level is high flow oxygen. We want to give our oxygen, but we're going to temper that depending on our pulse oximeter reading. But we can always take away the oxygen, and we want to start with giving them oxygen and doing our basic assessment, basic treatment, and basic vital signs. So oxygen, nitro, aspirin. Now this person had an acute onset of chest pain. This other person may also have what's similar, might be acute or maybe insidious or chronic. But in pericarditis, they usually have had some type of infection that went on, something like a respiratory infection. And they'll complain of chest pain. It's a little different. This pain is positional. It feels worse when they kind of lay back. And it feels better when they kind of lean forward. The definition of pericarditis is the inflammation of what this sac that lines over the heart muscle.
Pericarditis.
And this is called the pericardial sac. So pericarditis is the inflammation of the pericardial sac. And sometimes the lining, and it inflames and it irritates the heart muscle. So pericarditis is much different as far as the pain description, and it's better when the position they're in leans forward as far as just leaning back. All right, and this patient, if you were to give them nitroglycerin, it probably wouldn't help at all. It doesn't change the description of their pain. Again, a different type of history, different type of complaint. What I'm going to tell you though, this will give you what's called a false ST elevation. False ST elevation. So we'll see these type of ST elevations as we saw up here in the acute myocardial infarction. They're going to have these large ST elevations all over, and it's just false because this doesn't fall into the same type of symptoms or signs that the patient will tell us in their history.